Welcome back this afternoon. We're helping to raise awareness for cancer here at 5 Eyewitness News. And today we're focused on colon cancer. And we're so happy to have Dr. David Perdue here from MNGI Digestive Health to help us answer some questions. Doctor, thanks for being here.
Thanks for having me.
A colonoscopy is key. A lot of people know what that's all about. It can help to screen for colon and rectal cancer. And this is an important step. These screenings are critical.
I think the important thing to remember is that a colonoscopy can not only find colon cancer when it's early and really easy to treat and cure, but can prevent the disease. So colon cancer starts out as polyps, and during the colonoscopy, if we find polyps, we can remove them safely and decrease your risk of colon cancer by 90%.
It's something that people just don't love talking about, but this is important to kind of be right up front with when it comes to your own personal health.
It's a foreign idea, right?
Yeah.
Just the idea of doing it, certainly that's a barrier. But it's pretty easy, really. I mean, the day before, you do a bowel prep. We want you cleaned out so we can see your colon and not what's usually in your colon. Right. But during the procedure, we give you medication, you go to sleep, you wake up, it's over.
You can save a life by talking about this, even though it might be a little uncomfortable. So who is most at risk here these days?
Yeah. So certain groups are more at risk, African Americans, American Indians. But the other group is really people with a family history of polyps or of colon cancer.
And you see on the screen we had 1 in 23 Americans are diagnosed. So it's very prevalent. So it's important to get out in front of it. Early is key when it sounds to starting that colonoscopy.
That's absolutely true. So it is the second leading cause of cancer death in the United States behind lung cancer. And if you're a non-smoker, for non-smokers, it's actually the leading cause of cancer death.
I wanted to read something that surprised me. It's the most common cause of cancer death in men younger than 50. And there are symptoms that you should be watching for, but that stuck out to me because you just think of it as something that happens later in life. I'll get to it later. But you really got beyond this.
Yeah. I mean, we are starting to see colon cancer. It's not common in people under 50, but it's becoming more common. In fact, last year, the American Cancer Society recommended we start screening at age 45. Other recommending bodies are looking at that literature, deciding if they want to follow in suit. But I think the take-home message there is not to just blow off symptoms. You know, if you're having blood in your stool or abdominal pain or increasing constipation, and even if you're younger, that needs to be considered.
Your body is trying to tell you something, so take action.
And we can figure that out.
Dr. Perdue, thank you so much for your time this afternoon here on Eyewitness News. Appreciate it.
I appreciate it.
Now, if you have questions right now, maybe from this conversation, we sparked an idea in your head. You know, our friends there from MNGI and the Colon Cancer Coalition are standing by right now to take your calls. They're going to be there till 1 o'clock this afternoon, so you got about 45 minutes to go. The number's at the bottom of the graphic here on your screen. It's 651-659-7000. Don't be shy. Give them a call.